All right, we're going to move on to the next virus family, which are the flaviviruses. Except for hepatitis C, again, which we discussed with the hepatitis viruses, all of these viruses are arboviruses, all right? So they're enveloped viruses. They're all, again, except for hep C, spread by the mosquitoes. And the viruses that you see listed here are the ones that we're going to specifically discuss. So what we've done again is kind of put this in a table format for you, make it a little bit easier. St. Louis encephalitis and West Nile encephalitis, unfortunately, you can't go based on geography here. So you can't get a patient from St. Louis with encephalitis and definitively say, oh, it's St. Louis encephalitis, because it's not just in St. Louis. We see it actually a lot in the southern states. West Nile virus, of course, isn't just in the West Nile anymore. That virus actually first came into this country in 1999 in the Northeast and began to spread slowly over the next few years over every single state in the continental U.S. And what we saw with that West Nile virus, basically epidemic, was that it usually affected specifically the elderly. The elderly usually died from West Nile virus, whereas most other people that were exposed to West Nile virus either were asymptomatic or had what we call West Nile fever. Now I want you to notice that the vector are the mosquitoes and the hosts are the birds for these viruses. And one of the ways, if you remember, when West Nile started sweeping across the country, they would assay for the virus by looking at mosquitoes, but also looking at birds. Okay? The best mechanism we have of prevention for St. Louis encephalitis and really any of the arboviruses is going to be, again, back to control of the vector. Okay? Now, what I'm going to say to you about the encephalitis viruses is that it's very difficult to ask you a question about them because there's really no good way to differentiate between them. Okay? Now, the leading cause of viral encephalitis in the U.S., if you remember what we said, was herpes simplex virus type 1. All right? So these make very difficult questions to write. So unless they put something really specific in there, like for West Nile virus, they maybe put something that this virus only entered the U.S. in 1999, then you'll be able to determine it's West Nile over a lot of the other arboviruses. Otherwise, very, very difficult to ask a question on a lot of these encephalitis viruses. All right. Dengue virus and yellow fever virus are arboviruses, but these are viruses that are more hemorrhagic, okay? Now, dengue fever is a very kind of unique disease. In dengue fever, the first time you get infected, you get what's called breakbone fever, where you get a very high fever, but you get very severe muscle and joint pain. Yes, even I have had experience with this, not personally, but I had a family member go down to Costa Rica and come back with breakbone fever. She was 18 years old, came back in so much pain, they hospitalized her and put her on a morphine drip, okay? So that's what kind of intense pain we're talking about here. Now, that's breakbone fever. Aside from the fact that the infection totally sucks, you'd typically recover. However, if you live in Costa Rica, if you live in areas where dengue is endemic, your risk for dengue hemorrhagic fever and dengue hemorrhagic shock. What happens is with reinfection of dengue, you get a more severe disease because of the immune response. Now, I know that's far out. That's so backwards, right? The immune response protects us. In this case, the antibodies you make to dengue facilitate entry into other cells and speed up the infection and make it much, much worse. So, dengue hemorrhagic fever, you begin to get hemorrhaging in the blood vessels and vasculitis. And in children, this very often goes to shock, which leads to death. All right? Is this high yield for the USMLE? Probably not. We don't see it very frequently in the U.S., but as I told you, my cousin was diagnosed in the U.S. because she was diagnosed on her return to the States. So this can be one of those random viruses that they put in there, again, that we wouldn't necessarily call high yield, but they would expect you to know. Now, another one of those is yellow fever virus, which again is an arbovirus. The name of the virus itself should help you in figuring out what happens. Number one, it causes jaundice, which is how you get the yellow discoloration and how the virus got its name. It targets other organs as well, including the kidney and the heart and the GI tract as well. And since it's a hemorrhagic type virus, what it does is you start to get hemorrhaging in the GI tract, and you will start to get black vomit. All right? And that, along with the jaundice, is very diagnostic for yellow fever. Now, the last thing I want to mention about yellow fever, again, a good way to prevent all of these is by control of the vector, but you have to know there's a vaccine, because I've heard of very tricky questions that address this. You have a patient that presents with the classic symptoms of yellow fever, and they want to know what the best, I repeat, the best mechanism of prevention is for the above infection. And the two things you're going to struggle with is, number one, they're going to put vaccine on there, and number two, they're going to put mosquito netting. So you're like, oh yeah, it's an arbovirus, it's a mosquito. It's mosquito netting. And if you forget that it is covered by a vaccine, you're going to miss that one, because a vaccine is always the best mechanism of prevention.